Welcome to the Banished Cancer Podcast. I'm Rachel, and today we're exploring an important milestone for childhood cancer survivors, the transition from pediatric to adult care. Joining me is James, our cancer wellness educator. James, thank you for being here.
Thanks, Rachel. This is such a critical topic. For many survivors, moving from pediatric to adult care feels like stepping into the unknown. But with preparation, it becomes a chance to grow stronger and more independent.
Let's start with why this transition matters. What changes as survivors grow older?
As survivors age, new health needs often appear. Some effects of cancer treatment don't show up until years later. We see things like heart or lung problems, memory or learning difficulties, and even risks of secondary cancers. Mental health challenges are also common: anxiety, depression, or fear of recurrence. That's why staying connected with doctors who understand your history is so important.
That sounds like a lot to manage. How early should survivors begin preparing?
Experts recommend starting around age 12. It may sound early, but that's when survivors can begin practicing self-advocacy, asking questions, expressing concerns, and learning to manage appointments. Parents play a big role too, offering support while giving space for independence. Over time, survivors build confidence to take charge of their own health.
And what tools help make this transition smoother?
One of the most powerful tools is a Survivorship Care Plan, or SCP. Think of it as a health roadmap. It summarizes treatment history, outlines possible long-term effects, and provides guidance for follow-up care. Large studies show SCPs improve survival rates, and organizations like the CDC strongly support them. Having this plan makes it easier to communicate with new doctors and ensures continuity of care.
Choosing the right adult care provider must be a big step too.
Absolutely. Survivors should look for providers who understand cancer survivorship and are willing to coordinate with pediatric teams. Shared care models, strong communication, and provider experience all make a difference. Meeting new providers before fully transitioning can ease anxiety and help survivors feel confident about the change.
What about challenges? What tends to get in the way?
Insurance changes, communication gaps between doctors, or emotional stress about leaving a trusted pediatric team are common. Some survivors may feel nervous about losing the familiar support of their childhood care team. Others face barriers related to coverage or distance, but resources exist. Programs like Survivor Link, TM, and Passport for Care help survivors securely store and share medical history, while support groups and counseling provide emotional strength.
That's encouraging. And emotional support seems just as important as medical care.
Exactly. Survivors may feel nervous, sad, or even guilty during this transition. Support groups, counseling, and family encouragement can help process those feelings. It's normal to feel a mix of emotions, but no one has to face them alone.
Before we wrap up, James, what's one takeaway you'd like listeners to remember?
Start early, build a survivorship care plan, practice self-advocacy, and stay connected with your care team. With preparation and support, the transition to adult care becomes less intimidating and more empowering. Survivors gain independence, confidence, and better long-term health.
Beautifully said. James, thank you so much for sharing your expertise today.
Thank you, Rachel. It's been a pleasure.
Sharing knowledge is part of healing, because when we learn together, we grow stronger. Share with the ones you think need it. This has been the Banished Cancer Podcast.